Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about the autonomic nervous system and the autonomic nerve fibers. We've talked about the autonomic nervous system in the past, and as you remember, when it comes to the peripheral nerves, you have the somatic nervous system, which is the sensory and motor nerves, and the autonomic nervous system, which controls the automatic functions of the body, which includes innervation of the smooth muscle and the organs and the glands in the body, and it controls all those automatic functions, which are very, very important. As you take that autonomic nervous system, you can actually break it down into the sympathetic nervous system and the parasympathetic nervous system, where the sympathetic nervous system controls the fight or flight. So if you're in an emergency or whatever, this would be the system that actually turns everything on so you can actually get away. And the parasympathetic nervous system does the exact opposite, where it controls the rest and digest, or feed and breathe, depending on how you want to talk about it. So because of that, you've actually got those two different pieces. The autonomic nervous system, because of the great value that it has nerves that are in the central nervous system, including the brain and spinal cord, and extend from that system down into the body, and postganglionic nerves, which are on the outside of the central nervous system, which are really the peripheral nerves that we talk about in most cases. That being said, there are really three types of nerve fibers that work for autonomic nerves. The B fibers, which are primarily only in the autonomic nervous system, and the A delta and C fibers, which are common also in the small fiber neuropathy. So because of that, you have a large overlap between small fiber neuropathy and autonomic neuropathy. Some of the tests that we use for autonomic neuropathy will also indicate that you have some form of small fiber neuropathy because of the findings on the A delta and C fibers. So that being said, there is a big problem in most cases because individuals don't always test autonomic neuropathy. Autonomic neuropathy can cause a wider range of symptoms, a wider range of problems because of its control on the automatic functions of the body, including blood pressure, heart rate, sex drive, and all those types of things that actually can directly interfere with the functioning of the body and the functioning of your life. So to be able to have an extraordinary life, like we always talk about with peripheral neuropathy and thriving with peripheral neuropathy, it is important that you understand the autonomic neuropathy system as well, and that you treat the nerve fibers that are malfunctioning. So to give you a quick reminder, A delta nerve fibers are myelinated. B nerve fibers are what they call moderately myelinated, which means they're less myelinated than the A fibers, more myelinated than the unmyelinated C fibers. So with the autonomic nervous system, you have both myelinated and unmyelinated, with the unmyelinated being the biggest problem typically when it comes to peripheral neuropathy. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 128, talking about the autonomic nerve fibers, which are the A delta, B, and C fibers. So when you're talking about how they're being treated, and the studies are showing the different types of fibers, these are the three fibers that will be affected and that will be treated to help your autonomic